Today is my day off. I worked 6 out of the last 7 days, and I had 2 days off. I go back to work tomorrow. But having these days off don't feel like days off to me. It's been stressful not being at work, believe it or not. I feel helpless. I feel like I could be at work helping my coworkers. I feel like I could be more of use if I was at work right now versus being home and doing nothing. I feel guilty that I'm not there to help them, that I'm not there to lend a hand. It just doesn't feel right. As much as I know that, I need my days off, I need this time to de-stress and relax and get a break, I still feel guilty. And I know my other coworkers, feel this way too. We just want to be there for each other. We want to be a part of what's going on. We want to help each other out. We want to see our patients get better. We want to be there for that moment that something good happens. And we also want to be there for each other during that moment when something bad happens. And I just feel like that's where we need to be right now. And days off are rough. I spend most of my days off thinking about everything that happened at work. I am worried about my patients. I think about all the things I did for my patients. I think, what didn't I do? Did I forget to do something? Could I have done more for that patient? Did I, try hard enough that day? Did I give it my all? Did I give that patient the best shot? I read constantly to see if there's anything more we're not doing. I look at what other hospitals are doing to see if we're on par with them, and just basically trying to do the best I can to give the best to my patients. And I spend my days off doing that. I worry about patients if they're doing well when I'm gone. I worry about patients passing away when I'm gone. I don't sleep well. I have a lot of nightmares. I toss and turn. And I know, my other coworkers are feeling the same way. We talk about it at work with each other because, we understand each other and we're all kind of in the same boat. We're all feeling helpless. We're all scared. We're not sleeping. We're having nightmares. On our days off, we feel sluggish. We feel unmotivated. We don't want to do anything. We don't want to get out of bed. But we have to keep trying our best to do that because we have to continue to have some sort of feel some sort of normalcy. We have to, take care of ourselves so we can give our best at work, and we can't just fall into like this slump. So I'm trying. I hope my coworkers are trying. It's just really hard. It's really, really hard. Everything is a struggle. I don't even want to go to the grocery store. That's what I have to do today, and I'm dreading it. I don't want to pull into the parking lot, wait online, stand 6 feet apart, make sure I don't get too close to anybody while I'm there. I bring my Lysol spray down my cart, sanitize my hands after I touch everything. And then I feel guilty about that too because I know that I'm exposed at work and I'm going out into the world and possibly exposing other people. I mean, of course, I'm going to wear my mask and I'm going to take all my precautions, but I feel guilty. But I mean, that's something that I have to do. This is essential. I'm not going out for fun. I'm going out because I need groceries. So I have to do it, but I'm not going to lie when I say I do feel some guilt about it. I just want this to be over. I don't feel like it's going to be over anytime soon. They just extended the quarantine to May 15th, and I feel like it's going to be much longer than that. Although the number of new admissions coming through the hospital seems to have slowed down, I'm still seeing lots of patients decompensating within the hospital. I'm still seeing patients that are on like the medical floors getting sick, getting put on ventilators in an emergency situation and being brought to the ICU. Still seeing that. I'm still seeing the same patients for the past 2 weeks in my ICU, not getting better. And that's heartbreaking because we're giving it our all. We're doing everything we can for these patients and they're not getting better. And that's what we were trained to do. That's why we do what we do, right? To cure people, to help people, to get them better. And we are not able to achieve that. Granted, we have good stories. The last shift I worked, we got 2 people off breathing machines just on my unit alone. And I think it was a total of 5 within the hospital. So anytime someone comes off a breathing machine, They play overhead in the hospital the lyrics to Just Breathe. So you can hear it every time someone comes off the machine. When someone comes off the machine in our unit, we clap, we say yay, you know, we make a big deal about it. We make sure we play the song. So that's good. Those are good things. And I'm not taking away from the good things, but I do feel that the bad is outweighing the good in terms of there's so many more patients that are not coming off the machines. You know, I have a 30-something-year-old girl who's been with us since end of March, so coming on to 3.5 weeks, maybe, I think, at this point. And she's not coming off the machine. She's 30-something years old. She has no medical problems, and we can't get her off. She is on very high settings on the ventilator. We have given her every treatment that, you know, foreseeable, and we've tried different modes to get her off the ventilator. We've tried different routes to try and get her, you know, on lower settings to get her to the point of being able to breathe on her own, and we can't. And, you know, we're just stumped. Every day, you know, we round on her, the physicians, the PAs, the NPs, the nurses, and, you know, anything to add, and we have nothing. This virus has taken control of people in ways that we can't figure it out. We literally can't figure it out. It is attacking their lungs in ways we've never seen before. That, you know, a young girl like this should have been off the machine by now. If this was the flu, if this was a regular pneumonia, there's no reason why a young female with no medical problems is still on a breathing machine 3 weeks later. And, you know, what do we do? What do we tell the families? How do we live with ourselves at the end of the day that we can't make her better? And, you know, my coworkers and I were talking the other day. We're wondering, like, where's the autopsies? Where are the scientists out there doing autopsies and looking at these bodies post-mortem and telling us what they're seeing? Because that's what we need to know. We need to understand the disease process. We need to understand what's going on inside these patients' bodies that didn't survive. This way we can try and figure out how to make them better. Yeah, there's all these experimental drugs out there. There's the Plaquenil, which is not working in my experience. I have not seen it work for one person. Then there's the Remdesivir, which is a new trial that they use for Ebola. We just started using that in very select patients. We actually only were approved for 10 doses, so very, very selective. And there's the plasma exchange, which also is very limited, very hard to come by. You have to meet a certain criteria to get the plasma. Did I miss any? I mean, those are the 3 major drugs that treatments that we're using. We're also starting to give people blood thinners because there's some theories out there that these patients are clotting and that's causing them to get really sick. So we're putting people on blood thinners. But so far, I haven't really seen any of it work. We're also using Actemra. That's a drug that interferes with the cytokine response in our body that is believed to be happening from the virus. I have seen that work in a few patients. But also it's sort of a lot of bias involved. Did they get better just because they were going to get better anyway, or did they get better because of the drug? We don't know. But we need to understand the pathophysiology. We need to understand what's going on inside these bodies. We need someone to look at these bodies in the morgue, take them from the morgues, take them to the lab, do an autopsy, and tell us what they see. I mean, every scientist out there right now should be researching COVID-19. That's what we need. That's what we need to get to the bottom of this, because it's frustrating every freaking day going to work and not knowing how to treat these patients. And there are people dying that maybe shouldn't be dying. And maybe they will. Maybe they're going to die regardless of what we do and regardless of what we find out. But I think we should be trying a little harder to find out what is actually happening inside these bodies. The news, the governor, the president, they're all talking about a vaccine. A vaccine does nothing for the patients now. It does nothing for the patients that are dying in the hospitals. It will only prevent this in the future. It's not going to help the people who are dying now, and that's what we need. We need to be able to save more lives. We need to be able to make sure people aren't going to die from this anymore, because the families can't take it. I can't take it. My coworkers can't take it. It's too much. It doesn't make sense. It's not fair. We should be able to figure this out. We should be able to have some sort of insight. I'm not a scientist. Maybe there's more to it than just simply taking a look, but that's kind of, how we feel. Um, and, you know, one day it's going to all be over. And I hope that when we look back, we're going to feel proud that we did do our all. I hope that when we look back, we're going to feel proud that we gave it our best. And we'll remember the patients that, you know, we did do good on. And we'll remember the patients that, you know, survived and we were able to make a difference. And I hope that the family members that are going through this are thankful for everything we've done, and I hope that they know that we're doing everything we've done. I will say, though, actually, that I talk to a lot of families day in and day out. I call them to give them updates, whether it's good or bad, and almost all the families that I've talked to have been so wonderful. I mean, so kind. They're all very thankful. They tell us how thankful they are. They tell us that they're grateful for us. They know that we're working hard. They're so understanding. And they have no idea what's going on, you know, in the walls of the hospital. They only know what they hear on the news and, you know, what they maybe infer from what they hear and see. But they all are always saying, thank you to us. Thank you so much for all you've done. I know you're very busy. God bless you. Take care of yourself. I hope you stay well. And it's really nice to hear. Because it is so hard, and at least the family members are making us feel like they understand and they are sort of, you know, on our side. So, yeah.